We're back and you're watching News Channel 3 live at 9. To ramp up its fight against the coronavirus, Shelby County will open up vaccinations to everyone 16 and older starting tomorrow. This morning, we are joined by two members of the Memphis-Shelby County COVID-19 Task Force to learn more about those efforts and why it's also so important to still get tested for the virus. We're live now with the CEO of Poplar Healthcare, James Sweeney, and Dr. Keith Norman, who is with Baptist Memorial Healthcare. Gentlemen, welcome live at 9. Good to see you this morning.
Good morning.
Good morning.
Let's start with opening up the vaccinations to people 16 and older. I've kind of heard both sides of this argument here. Some people are saying this is great. More people will have access to getting the vaccination. On the other hand, some people say maybe this is a way we're kind of giving in because some of the groups that really need to get vaccinated are not. How do you see it, Dr. Norman? Let's start with you.
Well, thank you, Alex. I think, first of all, this is a good thing to do because when you look at the numbers right now, the spread is among younger Americans. And so we definitely need to get into that category. We've seen what took place in Miami over the weekend with spring break and all of the gatherings. And so it's so important that we protect everyone who has made up their mind. There are still some people in the other categories who are coming to that conclusion, making that decision. And so while they're getting good information and moving towards that end, we need to vaccinate as many people as possible so that we can achieve community immunity. I don't like to use the word herd immunity, but community immunity works better.
And Mr. Sweeney, to get more people involved in this, what is Memphis, Shelby County, what are we doing here to really kind of ramp things up to say, you know, this is your opportunity to come on out to take advantage of this?
With respect to the vaccination, it's exactly what Dr. Norman's saying. The city and the health system here in Memphis has done a fantastic job the last 5 weeks getting the vaccination up and running in a multiple of locations across the county. And the fact that it's now available to those 16 and older is a fantastic thing, and people should take advantage. We are actually seeing a slight uptick in positivity rate, and to Dr. Norman's point, it is in younger people. So either with the new variants that are beginning to emerge, like the UK variant, which has been reported to be here in Shelby County, that seems to be more infectious. It's also beginning to affect younger people. So a combination of get vaccinated, and if you are symptomatic or feel the need, get tested. And that way we can stay ahead of this.
That is the perfect transition right there. Obviously, we've heard so much emphasis recently, it seems, on getting the vaccine. But what about the importance, Dr. Norman, of getting tested these days? Why do we still need to do this?
Still a number one priority. We can do both and at the same time because getting tested helps us to discover if and how much of the coronavirus that we still have in our population and if there are variant strains that are entering in. The sooner we get this information, we'll be able to determine if we need booster shots for Pfizer or Moderna. We will also be able to determine how those who are already vaccinated are responding if there are variants. People can still get coronavirus and spread it to others. So we want people to be aware that get tested, especially if you have any of those symptoms and if you've been exposed. Please get tested.
Yeah.
One thing, gentlemen, that surprised me this week, a report came out from the CDC saying that at least 10,000 Tennesseans are overdue in getting their second vaccination, their second shot. How concerned are you both about people not wanting to come back to get that shot?
I'm not extremely concerned that people are not wanting to come back. Scheduling is a very difficult thing. So we have learned, especially among African Americans in the community in which I'm most closely linked to, is that when people are working in regular jobs, 9 to 5, they have to take off work. And if they have to go to places where they have to wait long periods of time, or if they have to go to places where you have to stand in line, it's very difficult to schedule. We've had rainy days such as today. So the people who were probably scheduled for a second shot today, they may be slightly delayed a day or two. But there is a window of time. The city has done a tremendous job in also having indoor and outdoor places. And so we want to encourage people to be patient, go back and get that second shot so that the efficacy of the vaccine reaches its full potential.
We also, Mr. Sweeney, probably have a lot of people watching this morning who are either perhaps homebound or homeless. What's being done to make sure the vaccine gets to them?
The city is strategically trying to identify locations where they can do pop-up vaccination on certain days of the week, and then coordinate with local leaders, religious leaders in those communities to make the testing available. So, for example, they could set it up on a Saturday at a church in a certain part of town or in a parking lot in another part of town. I can't say enough how hard the city has worked to try to identify, in conjunction with the health system, to target those communities that need to get access to the vaccination by any means possible.
Here in Memphis and across the nation, Dr. Norman, we are still hearing about, unfortunately, disparities when it comes to who's getting the vaccine and who is not, especially in communities of color, the African-American community, the Latinx community here in Memphis and Shelby County. What's being done there to make sure the vaccine gets to them?
Well, I'm very proud of the work that we're doing at Baptist. One of the things that we've done recently is we've set up a full-time space in an African-American church where we are open, and we have also interpreters who will be there for the Latinx community. One of the things, the language barriers and other things that existed prior to COVID-19, we've been trying to eliminate those barriers and making sure that we knock down those walls to get people in. Let me go back to something that was said earlier, however, those people who are homebound. The Johnson & Johnson vaccine is the most likely vaccine for that population to receive. They are homebound. They won't have to come back for a second shot. People who are homeless, we're making efforts in that area to take our mobile van to go, and we've worked out arrangements with people all over the city. I called the Manor House the other day. We're trying to vaccinate that population. And so that Johnson & Johnson vaccine, when it's available in Tennessee, it's always there in small doses. But when we get larger supply of that, we want to target that particular population so that we can serve them effectively and efficiently.
And Mr. Sweeney, last word is yours very quickly here. Do you think we can really vaccinate all 650,000 folks? I know that's kind of part of the goal for some. Is that really doable?
I think it's very doable. Okay. And I'm going to use a sports analogy as an old coach. When you're ahead in the game, which we are right now, yet sometimes teams tend to play not to lose. Now's not the time to play not to lose. Now's the time to put the pedal to the metal. Let's finish this. Everybody that wants to get vaccinated can get vaccinated, 16 and above, and let's get this done.
Well, hopefully everybody will continue that sports analogy by saying, put me in, coach, for sure.
Yep.
Dr. Keith Norman, Mr. Sweeney, thank you very much for joining us. We do appreciate it.
Okay. Thank you.
All right, let's shift gears now. Let's talk a little